Good afternoon. Is my voice audible? Good afternoon, all. We are delighted to welcome Dr. Vikash Goyal, Senior Consultant Cardiology at Paras Hospital, Gurugram. He is with over 15 years of experience and expertise in complex cardiac procedures. He is leading cardiologist dedicated to advanced treatment and preventive heart care. We are honored to have him with us today and to share his expertise and insights on heart health. Over to you, Dr. Vikas Goyal.
Hi everyone, hope you all are doing well. So myself, Dr. Vikash Goyal, World Heart Day. We celebrate World Heart Day on just a minute. Slides, मेरा slides visible है?
नहीं सर, आप
Music.
स्लाइड पे जाओगे तभी विजिबल आएगा। हाँ, आप यहीं से चेक करना विजिबल है।
No, visible है आपके. So World Heart Day is celebrated on uh, World Heart Day is celebrated on 29th of September every year. And every year we decide to have some theme so that we can serve better for the community and can help a patient. I am a I'm an intervention cardiologist. Today also we did one special kind of a procedure called a small pacemaker we put inside the body. It's micro kind of very small kind of pacemaker. So, but I believe that prevention is better than cure, and we all are young guys, maybe between the age of something between 30 to 60 years, and we are too much stressed in our daily day-to-day life, and because of that, sometimes we feel we go in panic attacks. Maybe there is a risk of heart diseases, and today we will discuss how we can have a better life. So we will start our discussion with basic things, and in the end, we will discuss what best we can do and what is our theme for this year. So, what is heart disease? Basically, if we have to understand the heart disease, we have to understand the heart. Can you see in the down there is a heart shaped structure, and it's typically in the same way we use in the emoji in the inverted way. It is a broad and this is narrow thing. If you put upside down, it's like heart shaped. So heart is basically an organ which start functioning from the womb. हम माँ के जो पेट में होते हैं वॉर्म उस समय से एट द एज ऑफ 6 वीक्स टिल वी डाई. तो इट्स द मोस्ट हार्ड वर्किंग एम्प्लॉय. हमारे जो सबसे ज्यादा हार्ड वर्किंग एम्प्लॉय है वो ये है. And it pumps around 4 to 5 liters of blood every minute doing rest. It supplies by pumping the blood. It's make a channel to distribute the nutrients, oxygen to all body and including itself. How does it supply blood to itself is through these coronary arteries. You can see these branches like of things. These are the coronary arteries. Through this, it supplies blood to itself. When there is a blockage in this part, the supply is affected, and the part which does not have any supply of blood will get die, and we say patient is got heart attack. So heart attack can be sudden because of the rupture of the layer which is there, that tissue layer in the blood vessel, or erosion of the layer, or it can be gradual. Gradually, it happens when there is a plaque deposition over the period of time, and it leads to significant blockage, which leads to chest pain. Any generally, when we talk about the heart diseases, we talk about the cardiovascular system. In cardiovascular system, we always include the brain, the legs, and the other arteries of the hands, and also the heart. In the heart, we have different kind of diseases, which starts from the before we born, like the congenital heart disease, in which there can be holes in the heart, or it can be a valvular related diseases in which this valve is not functioning properly, or the heart attack, or the electrical abnormality, means palpitation, low heart beating, fast heart beating. These are the possibilities of the diseases. So, but out of all the diseases, the most lethal cause is the heart attack, coronary artery disease, or we say the blockages, stenosis. These the terms which we use, and it's the leading cause of the death, mortality in the world. So, what are the symptoms of the coronary artery disease? If there is a blockage in the coronary artery, what can be the symptoms? There are four cardinal symptoms. One we know is chest pain. हमको सबको पता है छाती में दर्द होगा. Second is the shortness of breath, dyspnea, breathlessness. Third is the fatigue. Fourth is the palpitation. In the chest pain, the patient will feel comes like this sometimes and feel the chest pain in the chest, and it should be more than the fist area. It should be more than the fist area, may or may not relate to any of the arms. It can relate to right or left. Generally, the site of the pain is from umbilicus line to the lower jaw, in between any area. If this pain is for one finger, two finger, four fingers, it's not because of the heart. It felt like a heaviness in the chest. It's वजन जैसा लगेगा जैसे हाथी बैठ गया हो, या सब स्टोन या ऐसा कुछ रख दिया गया हो. Pricking type of chest pain is not related to heart issues. Another cardinal feature is the breathlessness. When we walk, we feel dyspnea. Generally, breathlessness is a major symptom of lung diseases. But second cause is the heart-related issues. Third is the fatigue. How can we define the fatigue, tiredness? Like we have a patient, he says, I'm not having any chest pain, no breathlessness. But when I go to from the house to just 100 meters, I feel that my energy is drained. I'm totally tired. In that situation, we say that patient is having maybe having heart issues. We call it fatigue. Second is the palpitation. Palpitation is feeling his or her own heartbeat. So these are the four cardinal symptoms. Out of these four, any symptom if someone is having, we should suspect for the heart diseases. We discussed just now how big is the problem. It's the number one leading cause of the heart disease in the world. But simultaneously, मैं डराना नहीं चाहता हूँ, मैं बताना चाहता हूँ. मतलब I want to make aware that you should be take care of yourself. But ऐसा नहीं है कि हमें डर करके बार बार अपना अपना चेकअप कराएं और बार बार अपना ईसीजी, इको और होल्टर ऐसे टेस्ट करें. अब now the problem is big. We need to understand India में as compared to the whole world. In India में we are more susceptible to the as compared to other groups. We have heart disease at younger age, and it's have more severe and malignant cause as compared to other places. So why so? Because of our habits, because of our genetic factors, because of our climate, that we are more prone to develop heart issues. So what increases the risk? Now we comes to the risk factors of the heart diseases. It's generally said that age is a risk factor. As we increase our age advances, we may develop the heart issues, but we can't do anything for this. So you can't help it. Another risk factor is the sex. If someone is having male, some is male, and few are if a person is a male, he is more prone to develop heart diseases as compared to female till the menopause because of the estrogen hormone they have. Another is the family history. We need to understand this family history thing. There are two kinds of family history. One is the genetic, which is transmitted through the genes. Another is the habit. Like my father is eating lots of ghee. I saw him, and I am also eating lots of ghee, and my son may also eat. So it's run in the family. What I have seen as my father doing, I will do same things, and it will lead to the further blockages. Pollution is one of the reasons because of which we may develop heart issues. What we can do for the risk factors are the cholesterol issues, smoking. If in young person, if we get a heart issues, the most common reason is a smoking. I will say 90% cases between the age of 30 to 40 years. Another thing is the blood pressure and the diabetes. These are the two risk factors which are the leading risk factors. And if it is uncontrolled, there is a high chances. But if someone is controlling it well, then chances are near about zero. Alcohol as such is directly not causing the blockages, but the snacks we take with the alcohol is harmful. But alcohol can lead us to the diabetes or the cardiomyopathy, in which heart pumping is decreased, or can lead to the liver issues, which may lead to the development of the heart diseases. Physical inactivity. Physical inactivity is one of the very important cause. If someone is very slim, thin, and is not doing any exercise, but as compared to that person who is doing exercise and obese, the chances of developing heart disease are more common in the thin people who are not doing activity. So physical activity is more much important than the obesity. And stress is also one of the cause, in which when we are in the stress, we generally use some kind of habits like smoking, alcohol, which again leads to the heart diseases. In cholesterol, we'll go one by one. In cholesterol, it's not like that someone cholesterol is high, he will develop the heart disease. It will take time, years of the years to develop the heart disease because it deposits in the blood vessels and gradually cause the heart diseases. It comes from the two sources. One is the liver and one is the from the food sources. Now we come the which is the good cholesterol and which is the bad cholesterol. So LDL cholesterol is known as the bad cholesterol, and it has a tendency to increase the risk of heart diseases. And HDL cholesterol is known as the good cholesterol. It's higher in the women and increases with the exercise. HDL cholesterol helps carry some of the bad cholesterol out of the arteries. So, which is the good cholesterol? HDL. Which is the bad cholesterol? LDL. In the lipid profile report, we just see the LDL cholesterol value and we target that, not the triglyceride, not the total cholesterol, not the VLDL or non HDL. Obesity. In obesity, there are two kinds of obesity: pear-shaped or apple-shaped. So pear-shaped obesity when we have more fat on the hip and thighs, and apple-shaped obesity when we have more fats around the belly. So apple-shaped obesity are at higher risk. Physical activity, it's very important. Key in physical activity, you should walk as much as possible, and daily 20 minutes of brisk walk is more than enough. Cigarette smoking, it increases the blood pressure, decreases the HDL, and is the leading cause of the heart disease in the young patients. Diabetes. Diabetes, sometimes we know that we are suffering from diabetes, sometimes we don't know and incidentally diagnosed as diabetes. It increases 2 to 3 times higher risk of the heart attack or stroke. and 80% diabetics die of the heart diseases. Now comes the what opinions and suggestions we take. Generally, when we go to a anything we want to purchase, like clothes, shoes, or something, car or something, we try to get the best. But when we need to take the advices, we take advice from the everyone. It can be your household, it can be just a person who is selling the vegetables. Every advice we take, and we just ignore the expert advice. So for my car, I want the best mechanic, but for my own body, we accept all kind of advices. So when we come to know about the diseases and the risk factors or diseases, how can we diagnose it? We can diagnose it through the test which we can do from the age of 20 years. Previously, we used to say from the age of 30 years. Now we say from the age of 20 years, ECG, echo, TMT, and we can do sugar levels and cholesterol level checks. These tests, if we do, we can diagnose if someone is having heart diseases. Before diagnosing and thinking about the heart disease, what we can do right now from the today onwards to prevent us from the heart diseases. First is the diet. Second is the exercise. So in diets, we always advise to take colorful fruits and vegetables so that we can have lots of fruits and vegetables and we have less fat in our diet. And person who take non-veg, generally we advise to take the lean fat meals like chicken, fish, lean cuts, and in that make a preparation in which there is less oil. Milk is as such, we never say ki don't take milk, but whatever milk you take, it should be toned or it's free from the that malai. Generally, multigrain food items are better than the eating only rice or only wheat. When comes to the oil, the all oil and ghee are bad, but definitely the coconut oil, palm oil, and ghee are the worst. And in the palm oil, recently I came to know that in few ice creams they are made up of palm oil. So we should avoid the things which are made up of palm oil. We should make a habit of reading what all of the constituents of the foods we purchase from the outside, like chips, like they are puff cones, like any kind of biscuits, ice creams, all those things. So which oil is better is sunflower oil, soybean oil. These are the polyunsaturated fats. These are better. Or else we can use the mustard oil, olive oil, groundnut oil. All these are better than as compared to the ghee, and that too in the minimal quantity. Second comes the exercise. The exercise कितनी करनी है? Exercise करने से we feel good, we feel motivated, we feel less depressive, and simultaneously we feel more young, and it increases the HDL. The only way to increase the HDL is exercise, and it lowers the LDL cholesterol. How much exercise we should do? Just walk. Best exercise for the heart is walking. Brisk walk. No need to go gym and all. Definitely you can go to gym, but after walking, you should can do the weightlifting or strength training exercises. Smoking is the worst thing. We should stop the smoking. If someone stop the smoking now, there is 50% risk reduction in 2 months, and it takes 2 years to become a equal level of non-smoker. Everyone should know their number, which is the LDL cholesterol, total cholesterol, BP number, and the sugar values. It's not the mobile number. Blood pressure, definitely everyone in the house should check their blood pressure at least once in a month from the age of 30 years, and from the 20 to 30 at least once in a year they should check their blood pressure. I have few patients between the age of 20 to 30 who are diabetic and who are having hypertension, BP issues. So because of the lifestyle changes, now we are developing these diseases at an early age. Controlling blood sugar plays a very important role. We should focus on that. Now comes if someone in your family or yourself develop a heart disease. Whether it's end of the story, no, it's a beginning of new chapter. If someone is having stunt, blockages, bypass or something, it's not end. With the changing the habits and find out the reason why we develop the heart disease, we can have a good life ahead, even 20 to 40 years of the good life. So we have to take care of the things. We have started this program from the 2022, in which the theme was use heart for the every heart. And now onwards, there is a theme for every year. So now this year the theme is don't miss a beat. What does it signify? Don't miss a beat. Its significance is don't miss a single chance to protect, to keep your heart healthy. How can you do? There are four levels of the things which you can do. Is the personal responsibility. Personal means what habits and actions we take our daily life. Like I give you an example. Office people generally they sit continuously for 2 to 4 hours. Instead of sitting continuously for 2 to 4 hours, they can just sit for 1 hour and then stand and walk around the chair, sit again. If a person is sitting continuously for 2 hours, it means it has smoked one cigarette. It's equivalent. But it doesn't mean that after every hour you go outside and get a cigarette and smoke it. So you can do on daily activities what you eat, how much you eat, whether you're doing overeating. So daily. Even we when we put the stunt or bypass in anyone, we suggest कि हमने अपना 10% काम कर दिया है, 90% आपको करना है. तो पेशेंट पूछता है डॉक्टर साहब फीस तो हमने पूरी दी है, चार्जेस तो पूरे किए, फिर आपने 10% क्यों नहीं किया, 100% क्यों नहीं किया. हमने कहा हमारा 10% काम होता है, अभी इस समय जो ब्लॉकेज है उसको ओपन कर दिया, दोबारा ब्लॉकेज ना आए और इस ब्लॉकेज को खुला रखें. इसके लिए आपको डेली, प्रतिदिन, प्रति मिनट, एवरी डे एवरी मिनट यू हैव टू वर्क, यू हैव टू थिंक and you have to do activities to save your heart from the diseases. Vigilance. Second, first is the personal thing, second is the vigilance. Vigilance means we should not be worried about the heart disease. We should be concerned about the heart disease. Like doing regular checkups, taking care of the habits. We should not feel कि पेन हुआ, छोटा सा पेन हुआ, हमें हार्ट अटैक आ गया, ऐसा नहीं है. We should understand the character of the pain, just we have discussed, and we keep a watch कि हमें टेस्ट कराने चाहिए annually या once in 2 years as per the finances. हमें रेगुलर चेकअप करना चाहिए, क्या हमें खाना चाहिए, क्या नहीं खाना चाहिए, उस तरह की चीजों पे ध्यान देना चाहिए. और थर्ड कम्स दी टाइमली इंटरवेंशन. अगर किसी को कोई दिक्कत हो गई तो उस समय बीपी की, शुगर की, कोलेस्ट्रॉल की टाइमली मेडिसिन ले, टाइमली इंटरवेंशन करें. और अगर किसी को हार्ट अटैक भी आ जाए तो टाइमली इलाज करें जिससे कि उसकी हार्ट की मसल्स को बचाया जा सके. फोर्थ कम्स दी कम्युनिटी रोल which already taken by this such a big, nice company that she has already enrolled more than 400 people as per my information, and she and the company is doing a big job by making 400 people aware how to keep your heart healthy and how to protect yourself from the heart disease. In the whole this talk, we are not talking about the treatment, we are not talking about the how to diagnose, we are always talking about the prevention. So what for the prevention comes the first, again I am repeating the same things, diet. डाइट प्लेज एन वेरी इंपॉर्टेंट रोल. सेकंड कम्स दी एक्सरसाइज. सो डाइट में हमें कलरफुल खाना है, नॉनवेज कम खाना है. नॉनवेज में चिकन, अंडे का सफेद पार्ट वो सब खा सकते हैं. एक्सरसाइज में ब्रिस्क वॉक हमें करना ही करना है, मिनिमम 5 days अ वीक, मिनिमम 20 minutes पर डे. उसके अलावा योगा, स्ट्रेंथ ट्रेनिंग जो करना है वो हम करेंगे, बट वी हैव टू डू दिस. थर्ड कम्स दी नो बैड हैबिट्स like the smoking, alcohol, and all those things. Fourth comes the keep a check on the cholesterol, keep a check on the sugar, keep a check on the BP. These things. And last comes the annual checkup with the doctor, expert opinion. Thank you. If you have any questions, we can discuss now. is something in the chat. We are opening that. So there is a one question: in less of the physical movement and high stress, how to take care of our heart? Wonderful question. In case of the less of physical activity, we try to tell the patients to increase their physical activity by doing exercises. If their time doesn't permit, even 5 minutes of brisk walk daily, morning, evening, anytime they can have, or what best they can do whenever they attend the phone calls, try to at least stand and walk as much as possible. I know one of my senior cardiologist, one of my teacher, whenever he used to receive a call, he used to take rounds of the hospital, or at least for an hour he used to walk like this. So this is the one of the way. Don't sit continuously for more than 1 hour. Whenever you have to sit continuously, you just stand, take a round of chair, and you can sit again. Third, in your cabin you can close the door and just can do the physical activity like the like we do PT, like this using hand say cycling and the leg cycling. These things we can do by using minimum time. And whenever we have to do the laptop work or any work, we can stand and do the that work. Then comes the how to take care of your stress so that you will develop less. See, there is no way we can switch off the stress button. So what we can do is we can have more enjoyable activities in our life. How can we do? First, expectations from the life. If we expect more, we get less, we feel stress. If we expect less, then fine. And at least give some time for yourself, 5 to 10 minutes per day, in which you just think about yourself, just you feel how you feeling whole day. And Saturday, Sunday, sometime you take out and you spend time with your friends, family, and all those things. When you sleep, before sleeping, at least half an hour before that, you stop your all gadgets and just take rest. These things you can do to decrease the stress, which can help you heart to be strong. Even after doing all lots of things, you're not feeling that can be decrease the stress. Just doing the exercise can help you prevent the heart diseases and taking care of the other activities. Now question comes the how cholesterol affects the heart health. So we have discussed in our slides. So that it deposits cholesterol. This one. So there is a cholesterol deposition in our blood vessels. So which leads to the blockages. So in that scenario, so cholesterol affects our heart. In this, especially the LDL, low density lipoprotein, is more harmful as compared to HDL, and HDL is very beneficial for the prevention of the heart diseases. Yes, I have a YouTube channel on my name, Dr. Vikash Goyal, Vikash. It's contain H also. So in that, I have mentioned all the questions which you have asked me. Now the next question is non-veg or veg, which food ideal for the good heart health? See, as per the scientific data, the animal fat is more harmful as compared to the plant fat. So in the same way, plant products are beneficial as compared to animal products. But I'm not against the non-veg thing. If someone wants the non-veg things, they have to take care of the few things. One, the which type of non-veg they are taking. Chicken and fish are better as compared to the meat. Second, the oil which they use and how much oil they use for the cooking. So sometimes they like to eat non-veg, but butter chicken, it contains lots of butter, and they use lots of ghee and all in the cooking. That we should avoid. And sometimes to eat the non-veg, we take different kind of maida type of rotis and all. That's harmful. So it depends what you are, how you are taking the non-veg. So veg is better than non-veg. I am happy there are so many questions. So next is the what are the tests that you can suggest for a male over 45 years to check heart condition? Wonderful question. Not only for the male, for the female, male above the age of 20 years, I will like to suggest 5 6 tests. One, consultation with the doctor that includes checking your risk factors and checking your BP. Second, HbA1c, that includes 3 months of का sugar का बही खाता data, and that indicates whether you are diabetic, pre-diabetic or what. Third is the cholesterol check. We need to check cholesterol. We need to check the cholesterol. Fourth is the ECG, echo, echo and TMT. These are the 6 tests we need to check: ECG, echo, TMT, and BP, and consultation, and HbA1c and cholesterol. These tests we can do on annual basis for everyone from the age of 20 years onwards. Because nowadays we find few diseases in the younger patients. So next question comes. Cholesterol level is 238.6. Triglycerides. Please advise precautions and medicine to control BP is under. This is the consultation. This is not a question. You can come and consult with us. We will answer this. Okay. Next question comes. I am living in the Delhi. How do I reduce the impact of pollution? Good. See, the question next comes. In our slides, we have discussed what we can do for the few things and what we can't do. This one. So in this slide, we have mentioned you can't help it. For the pollution, you can't help it. You can help for these things. So developing a blockage, there is a multiple factors, not a single one. So generally what we can do, we can secure the things which are easy to handle. Like if we are driving a car, what we can do, we can change our luck, whether we get an accident or not. But what we can do, we see whether seat belt is fine, tires is fine, petrol is fine, engine is fine, all those things we can check. So we can do the exercise, take care of the diet and take care of the habits, take care of the sugars and other things. But the pollution, we can't do anything. What we can do maximum when the pollution is high, we just try to avoid going outside. That's it. So next question comes, what are the lifestyle and the health foods for maintaining a good heart health? We have discussed this in our talk that lifestyle means 20 minutes of brisk walk, at least 5 days a week. Avoid overeating, avoid sweets and sugars, avoid oily food as much as possible, and checking your sugars, cholesterol, and BP regularly. These things which we can do, we can have a good life. Next question comes, how to cure heart, healthy and fit. The same things which we have discussed just now. Yes. Now the wonderful question comes, the is gastric symptom can be indication of a heart attack. We have discussed what are the location. From the umbilicus, we take a line, draw a line around the umbilicus till the lower jaw. Anywhere between this area, we may develop symptoms of the heart disease. So gastric symptom sometimes can mimic as a heart attack. We have patients. We had a patient in developed some gastric discomfort for like 4 or 5 days, and when we checked, he was suffering from heart attack. So it can be confusing, but it generally associated with the risk factors. And whenever you develop any symptoms, you can visit a nearby doctor and they will diagnose it. So there is a next question. My mother is having gallbladder stones of 18.5 millimeter in operation. Only the operation is the way. Yes, operation is the only way, but it's a consultation. What are the cause of palpitation in a 45-year-old person working in an IT field? See, palpitation causes are many. The most common reason is anxiety and lack of sleep. Another reasons can be endocrine related, like the thyroid dysfunction. It can be anemia. It can be because of the heart issues, valvular structures. It can be electrical abnormality in the heart. So there are a lot of reasons. For this, we need to consult a doctor. So again, one more question related to palpitation, that I am a 45 years old guy and I feel my heartbeat goes high and pumping very fast. It can be A normal finding related to anxiety or stress, you have to find out whether it's happened only during the stress or it can be an abnormal finding. It's happening when maybe because of the some electrical issues in the heart, maybe because of the valvular thing. So you need to consult a doctor. Yes, this is very good question about the cardiophobia. Sometimes I feel chest pressure and the pain in my left shoulder. Chest pressure and pain in my left shoulder. I have done two checkups, but nothing serious was found. I have done two, three checkups and nothing. Few people do hundreds of ECGs and echoes. This cardiophobia we have discussed. We should not be worried about the heart disease. We should be concerned about the heart disease. When you found that same kind of symptoms are appearing again and again, and you have done two tests, that's normal. Just start ignoring with these symptoms. In the same way, we live with the situations we don't like. In the same way, we start living with the pain. If you feel pain different in character or nature, then we should consult a cardiologist as soon as possible. Next question comes. Sometimes I feel my heart portion getting punched or needle heart. No, no, no. Pinching type of pain or needle pricking type of pain is not related to heart issues. Generally, it's because of the anxiety stress or because of the vitamin D or B12 deficiency. We take care of these things, it will become better. Next question. Taking essential supplements. There is no requirement of any supplements for the heart thing. Heart does not require any supplements, and all the studies and guidelines always never recommended that you take any kind of supplements. Yes, this is again one of the wonderful question. I have discussed this in my uh, YouTube videos that if someone is developing blockages like 20%, 40%, 60%, 70, 80, 90, anything, by doing the changing the habits, can we decrease it? No. Once you develop the blockage, it will persist for lifelong. What you can do is decreasing the chances to get the heart attack and decreasing the chances to progress it further. If you do activities, it can prevent these. So heart attack and blockages are different. Blockage is 70%, 20%. Heart attack is when you suddenly get blockages which reaches to 90 to 100% we get heart attack. Heart attack means attack. Achanak se. Suddenly it happens. And blockages is gradual process. What are the possible symptoms of the heart ailments? We have discussed in our slides. These are the chest pain and general symptoms, are dyspnea, palpitation, and fatigue. How to get? We have discussed about this in the previous questions. How to get healthy heart while sitting on the chair doing office works? Like we can do the hand movements like this, hand cycling, can PT exercise, and can just sit every hourly and take a round of the chair and sit again. Very wonderful question. People get more worried about this is sometimes heart rate increases during activity, walk or workout. It's normal. When we are doing activity like walking, workout, exercise, our muscles need more glucose, more energy. So definitely we need to pump more blood to supply the same. It's demand supply thing. So it's natural. Nothing to worry. It can go up to 200 as well. Next question, need to know about the stress management, which checkups to be done to get good health. What are the general cause of heart attack analysis? How to have done it? Does it work out? Gym causes heart attack. We have two questions right now. One is the about the stress management and checkups we need to do get the heart health. Stress management, we need to have less expectations from us, then you feel less a little relaxed. Another thing is having joy in more in your life, like going for outside with the friends, family, and all. You feel better. And checkups which you can do is checking your sugar, cholesterol, and checking getting your ECG, echo, and TMT done. and one blood pressure check and consultation with a doctor. These tests may prevent you from the uh, and show you the early signs of heart diseases. What are the general causes of the heart attack in early age? How to avoid it? Does heavy workout or gym causes heart attack? We have discussed. We have for this also. I made a wonderful video that heavy workout or gym can cause heart attack if you do suddenly. If you gradually upscale yourself, then chances of developing heart disease is less. Like you have to train yourself. Like at the age of 20 years, you are not doing all kind of activities. For then few years, you are not doing any activities, and suddenly at the age of 40 years, you decide to become a Salman Khan. So then at that time, suddenly if you go and try to become Salman Khan in a day, the heart may not take that pressure. So we should go gradually. It may be possible that over the period of 20 years, you already having blockages. So we should check ourselves by doing the TMT and all, whether we are fine at this stage. Third, we take supplements in the gym that can be harmful. So we should not take unnecessary supplements. These are the three reasons for developing heart issues in gym, in persons who are going to gym. How to keep BP in limit without long-term medication? Yes, if someone is developing the beginning of BP, weight reduction, taking less salt, regular exercise, avoiding oily food, avoiding sweets and sugars, all these measures can help us to limit your BP medicines. Or sometimes you can have a BP issue, but it has been controlled on diet and exercise, means without medicines. It can happen. Next, what I have done to have a cardiac, what I have to do when a cardiac arrest happens to someone, also explain I do the immediate cardiac. Wonderful question. अगर किसी को हार्ट कार्डियक अरेस्ट आता है, if someone develops the cardiac arrest, what I should do? What you have to do is you have to learn the CPR. You have to do the cardiac massage. CPR. CPR. You go to YouTube and learn how to do CPR. You can do CPR on anyone. If yourself get a cardiac arrest, you can't do anything. The nearby person only can do. Cardiac arrest can happen in n number of reasons. It's not only because of the heart attack, maybe because of lung issues, brain issues, and all. We can do have to have good, healthy lifestyle things. That's it. What are the symptoms? Same for children below. One symptom, same for this. Below 10 years, developing a heart attack is near about zero. You don't think about it. If someone is developing cardiac arrest at the age of 10 years, it can be because of the other reason other than heart attack. Only thing which is possible is a congenital heart disease in which there is an abnormal connection between the different chambers of the heart, or they may be hollow or something like that. This is one more wonderful question. Myocardial biz. That someone is asking that my father diagnosed with myocardial biz, and he's teetotaler and he's following all the activities. So I will tell the myocardial biz is not a blockage. It's a normal not communication. I will say it is normal passage of the blood vessels. Instead of going from above the heart, it's going in between the muscles. And whenever muscle contracts, and that vessel also becomes contract. So no intervention is required in that situation. Just we try to slow down the heartbeat so that it get sufficient time to have the enough amount of blood. So myocardial biz is a normal phenomena. It's not a disease. Myocardial biz. Could you advise if it might be possible to stop the medications? For the heart disease patient, it's a little difficult. For the BP and sugar, it might be possible to stop the medications. Might be. I'm not sure it will be. If they take care of other things like weight, diet, exercise, and all the things. Then comes the, can you suggest natural ways to reduce the high triglycerides? Triglycerides high, cholesterol high. What we have to take? Avoid the oily food, do exercise, avoid overeating, weight loss, and taking care of these things, avoid smoking, triglyceride. One of the reason of high triglyceride is alcohol intake. So if you are taking alcohol, you stop that. These are the natural ways to decrease the triglycerides. I don't know how much success we'll get, but definitely it will decrease some amount of triglycerides. And I have seen this in lots of patients. Can you suggest what you do on this? If someone is developing a heart rate of 250 at rest, then there is no issues. But if someone is developing heart rate of 250 with exercise, there is no issues. If at rest, then he need to see a cardiologist and evaluate himself or herself. Junk food, how often we can have? Generally, we say once in month is definitely fine. Once in a week is also fine. But once in a week, it's not like whole day in a week. Once in a week is also fine. But rest of days you are taking care of other things, then fine. If you are already having adequate weight and your BP, sugar, and all is good control, then it's fine. Another question: risk associated with the blood pressure? Oh, no. Another question is risk associated with the blood pressure on heart. Definitely, if someone is having the high blood pressure, there is high chances of developing heart issues because high blood pressure causes some changes in the blood vessels and it lead to cholesterol deposition and high chances of heart blockages. Next question. Are there any warning signs or symptoms I should watch out for the to high cholesterol? Yes. If someone is having high cholesterol, there is some kind of marks just upper eyelid in the corner side near the nose. So by that we diagnose that patient may be having high cholesterol. And with the high cholesterol, we need to check it regularly, that ECG, echo, TMT, etc., to diagnose if there is any blockage right now, and we'll control the cholesterol. Is exercise helpful in controlling the cholesterol? Yes, definitely it's helpful, but it's not the only way. Sometimes we start with the exercise and diet and cholesterol is well controlled. If it is not controlled, even after that, we need to start on the medicines. Next wonderful question is how to control cravings. I try for myself what I do. Like if you want your chole bhature today, and how to control it. So what I decide, I will eat it tomorrow. So आज बचना है, कल के ऊपर छोड़ना है, पहला. दूसरा, I try to make it difficult to get that chole bhature for myself, so that it's not easy to order or like that. Third, I prefer to eat my choice of the food by going to the restaurant instead of ordering online. So we will not have less chances to get that. Second, whenever we eat something, what I take smallest bite possible so that my satiety center gets stimulated and after some time I feel happy. And the last, whenever I have to eat a food which is harmful for me, I try to eat something which is good for me. Like I will eat apples, salads, or fruits, vegetables, something like that. And the last, I will eat the things which are harmful for me. So I think I have answered all the questions. Uh, I tried to answer lots of questions. So we'll go to the theme thing. This year theme is don't miss a beat. So we'll not miss a single opportunity to keep your heart healthy. And I request everyone not to be worried, only concerned for your heart health. If you are taking all the good things like taking care of exercise, everything, then chances of developing heart disease near about zero, and you should not worry about that. You should be enjoying your life. That's it. I think questions are all over. I think questions are all over. So, anything else? Anyone? No more queries? Thank you. Thank you very much. So, can we disconnect now?
Yes, sir. Thank you.
Thank you.
Thank you, ma'am. Thank you.